Good morning. In this video, I'm going to discuss post-menopausal bleeding, what it means, test you need, and the treatment options. So post-menopausal bleeding is any vaginal bleeding that happens after 12 months of no period. And this is not normal. It should never be ignored. I have a patient who is going through some treatment because she was diagnosed with the cancer of the uterus. So I thought maybe I should create this video for you guys just to be aware. But the good news is that most of the causes are treatable, and early evaluation prevents serious complication. So today we will discuss why post-menopausal bleeding happens, what tests we order and which conditions are dangerous, and what kind of treatments are available, and when to seek urgent care. What counts as postmenopausal bleeding? If a woman has gone 12 months without period and then notices spotting, light bleeding, heavy flow, brown discharge, it's considered postmenopausal bleeding. Even one incidence deserves evaluation. What are the common causes? Most of the causes are benign, by the way. Common causes: vaginal atrophy is the most common cause. Due to low estrogen, the tissue becomes thin, fragile, light spotting. Treatment is simple. Vaginal estrogen, cream, or tablets. Number two, endometrial atrophy. Uterine lining becomes very thin and can bleed easily. Polyps in uterus or cervix. Non-cancerous growth causing irregular bleeding. Treatment removal is via endoscopy called hysteroscopy. Other causes endometrial hyperplasia, where the thickening of uterine lining, often due to unopposed estrogen. Some types can progress to cancer if not treated. So it can lead to endometrial cancer. And that accounts for about 5 to 10% of postmenopausal bleeding cases. So early diagnosis means excellent survival. Medication we use in situations other than polyps or growth or hyperplasia or precancerous lesion, we use hormone replacement therapy, right? Hormone replacement therapy also can cause bleeding problem in the beginning, but later on it stabilizes. Sometimes people are on blood thinner because of atrial fibrillation or deep venous thrombosis. That can also be a source of bleeding. So we count those as one of those causes, but other things has to be considered, and diagnostic test has to be ordered to rule it out, to make sure there is no polyps, hyperplasia, or any lesion in the cervix or uterus. So those are the causes. Most serious is, of course, endometrial cancer, and my patient was diagnosed recently, but she's going to have hysterectomy. Now, what are the red flags that need urgent attention? Now, heavy bleeding requires urgent attention, passing clots, persistent pain, bleeding after intercourse, that needs attention. Family history of cancer. How do we diagnose it? Pelvic examination, cervix is checked, vaginal examination, external structure for any lesions or dryness. Your OB/GYN doctor will take care of that, or nurse practitioner. Transvaginal ultrasound, it measures the thickness. If the thickness is less than 4 millimeter, the risk is very low. If thickness is more than 4 millimeter, it requires further evaluation. Endometrial biopsy is the next. It's office procedure, and it really tells if the lining is normal or hyperplastic or cancerous. Hysteroscopy is a camera procedure where camera is inserted in uterus to look for polyps, fibroid, and remove them. Blood test, check thyroid, complete blood count, clotting profile, and hormone level. Treatment options, it depends on the cause. For vaginal or endometrial atrophy, vaginal estrogen cream, moisturizer, lubricants. If there's a polyps, needs removal, hysteroscopically, same day office procedure. If there's endometrial hyperplasia, um, uh, it may require progesterone therapy or Mirena IUD, close follow-up, sometimes hysterectomy. Endometrial cancer, if the diagnosis is endometrial cancer, you need hysterectomy, removal of ovaries or tubes, sometimes the radiation and chemotherapy. But early cancer has very high cure rates. So you gotta stay healthy, maintain healthy weight, manage your other medical issues, diabetes, hypertension well. Avoid unopposed estrogen therapy. If you have uterus and if you are getting hormone replacement treatment, you need to be on both estrogen and progesterone. And you need to report any bleeding to your doctor immediately and get the workup started, because early diagnosis saves lives. Thank you for watching. Have a great Wednesday.